Hello, my name is Abby Brown. I'm in Dr. O's class for spring 2024 and it is April 7th, 2024. I'm going to quickly scan the room. And that's where my phone is, and this is my table. And then the floors, and then the ceiling. Okay, so we're going to start by assessing the head and the face, the neck, the anterior, posterior chest, and the abdomen. We're going to be looking for normal color, texture, moisture, temperature, skin turgor. We're going to look for any nevi, lesions, scars, bruising, anything that would be abnormal. Then we're going to look at the head. We're going to look for midline, size, and if normal and symmetric. Then we're going to palpate the head and scalp. We're going to look looking for normal hair distribution, hair color, hair texture, which is all normal. We're going to be looking for any infestations, depressions, lesions, tenderness, masses, anything that would be abnormal. Then we're going to palpate the temporal arteries for any tenderness there. Okay, then we're going to palpate the TMJ here, so open and close, okay? So no subluxation, no tenderness, and no crepitus. Then we're going to test cranial nerve number 5, which is trigeminal. We're going to palpate the masseter muscle and have you clench your jaw, okay? And then we're going to check light sensation, so just tell me where you feel this sensation.
Cheek, chin, nose, forehead.
Perfect. Okay, so next we're going to check cranial nerve number 7, which is facial. We'll have you pucker your cheeks, purse your lips, smile, frown, and raise your eyebrows. Perfect. Next, we're going to move to lymph nodes. So we have pre-auricular, post-auricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. Next, we're going to move to eyes. So first, we're going to look at the sclera, conjunctiva, eyebrows, eyelashes, palpebral fissures. We're going to be looking for normal color, lesions, discharge, anything that would be abnormal. Next, we're going to check cranial nerve number 2 with the Snelling chart. We'll stand about 6 feet back, and if you'll cover one eye, and cranial number 2 is optic. If you'll just tell me what lowest line you can see.
E, F, T, Z, G.
Okay, and switch.
O, L, D, F.
Okay, and then with your glasses on.
E, P, T, Z, O.
Okay, so it's 20, 30. Next, if you'll turn towards me, we're going to check peripheral vision also with cranial nerve number 2. So if you'll cover your left eye, and then tell me when you see this.
C,
See? See. Perfect. And switch.
C, C, C.
Perfect. Okay. Next, we're going to move along to cranial nerve number 3, oculomotor. And that is going to test light reflex. Okay, so pupils are responsive to light. And lastly, we're going to check accommodation and convergence. So if you look over there and then focus here, and then we'll move it in. Perfect. Okay. Next, we're going to check cranial nerves 3, 4, and 6, which is oculomotor, trochlear, and abducens. And so these are with the extraocular movement. So if you kind of look here, just follow my finger. Perfect. And lastly, we're going to check once again the red reflex. And so just kind of look here. Okay. Okay, so red reflex noted bilaterally and the optic disc seen. Next, we're going to move on to the ears. So we're going to look and make sure that they're symmetrical. We're going to palpate, make sure there's no tenderness or masses present, which there are none. We're going to look at the auditory we're going to look at the auditory canal and the tympanic membrane. So the auditory canal is pink and the tympanic membrane is pearly gray. And so we'll come over here and look. Okay, and the tympanic membrane pearly gray and the auditory canal is pink. And lastly, we're going to check the cranial nerve number 8, vestibulocochlear, with the whisper test. So if you'll plug this ear, just tell me what you hear.
1, 2, 3.
Okay, and switch.
1, 2, 3.
Okay, and next we're going to check the Weber test. So just, I'm going to ring this and place it on top of your head, and you tell me if you hear it in both or one is greater than the other.
Both.
Okay, and then we'll check the Rhine test, and I'm going to ring this bell, and you tell me, I'm going to put it behind your ear, then beside, and tell me if it's greater or one or the other.
Beside.
Okay.
Beside.
Okay, so air conduction bilaterally is greater than bone. Next, we're going to move on to the nose. We're going to inspect that it's midline and normal in size, and we're going to look at the nares and make sure that they're patent, which they are. We're going to check cranial nerve number 1, olfactory. So close your eyes. Tell me what you smell.
Alcohol.
Perfect. So it is hand sanitizer. And then we're going to palpate the maxillary and bronchial sinuses for any tenderness. Any tenderness?
No.
No. Okay, perfect. So no tenderness. Next, we're going to move on to the mouth. We're going to look at the lips, teeth, gums, the tongue, the buccal mucosa, the under the tongue, the posterior pharynx, and the uvula and tonsils, if there are any. Okay, so open your mouth. Okay, and then stick out your tongue. Okay. Yeah. Okay, so that was cranial nerve 9 and 10. So it was glossopharyngeal and vagus. So the uvula rises with phonation, and then the cranial nerve 12 is hypoglossal, and that is the tongue is midline without fasciculations. Next, we're going to move on to the neck. So we're going to palpate the trachea, make sure it is midline, which it is. Palpate the thyroid and swallow for me. Perfect. Then we're going to palpate the carotid artery pulsation. Okay. And then we're going to take a listen to any carotid artery bruits. Okay, so no bruits hurt. And then you could turn around. And so while she's turning, we're just going to look for any respiratory distress, like nasal flaring, retractions, tripod positioning, use of accessory muscles, cyanosis, or tachypnea, anything that would indicate respiratory distress. Then we're going to look at symmetry. We're going to look at any obvious deformities, which there are none. We are going to check for chest expansion, so just take a deep breath for me. Perfect. And then we'll do tactile fremitus, so just say 99.
99, 99, 99, 99, 99.
Perfect. Okay, so now we're going to take a listen. Oh, I'm sorry, we're going to take a cast. Okay, so resonant sounds heard throughout. Now we're going to take a listen. Take a deep breath for me. Okay, and if you'll turn kind of towards this way, and we'll listen to the sides. Okay, and then turn kind of this way. Perfect, okay. And next we're going to check for egophony, bronchophony, and whisper pectroliloquy. So if you'll say E.
E, 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 E.
Okay, and then if you say 99.
99, 99, 99, 99, 99, 99, 99, 99.
Okay, and then if you'll whisper 99. Perfect, okay, and then you can turn around. So now we're going to look for on the front side any obvious deformities here, symmetry, which everything looks good. Then we're also going to check for equal chest expansion here, so deep breath. Perfect, and then we'll check for tactile fremitus, so 99.
99, 99, 99, 99, 99.
Perfect, and then we're going to take a listen one more time in the front. Perfect. Okay. So now we're going to move on to the cardiac portion. So we're going to listen with the bell and the diaphragm to the aortic, pulmonic, herbs, tricuspid, and mitral. Okay. And then we're going to palpate at the point of maximal impulse. Okay. And then we'll set our timer here for 1 full minute. And we'll auscultate with the apical pulse. Okay, so rate was regular and it was 78 beats per minute. Okay, so we'll have you come lay down and we will move the camera. Okay, so now we're going to look for any jugular vein distension or JVD, which there is none. Then we're going to look for any heaves or lifts, which there are none. And then we're going to palpate for any thrills. Okay, so there is none. And then we're going to auscultate in each cardiac point with the bell and diaphragm one more time. So next we're going to move on to the abdominal contour. We're going to look for symmetry, make sure everything looks good and no abnormalities seen there. Then we're going to auscultate for bruits with the bell. We have the aortic, the renal, the iliac, and then the femoral. Then we're going to listen to in all 4 quadrants. Okay, so normal active vowel sounds seen, and then we're going to percuss. Okay, so tympani heard, and then we're going to palpate for any tenderness or masses. So tell me if you feel any tenderness anywhere.
No tenderness.
Okay, no tenderness. Okay, and no masses felt. And then lastly, we're going to palpate for the liver and the spleen. So if you'll just take a deep breath for me. Okay, and then we'll have you kind of turn, and then we'll palpate for that spleen here. Okay, so no liver or spleen felt. And we'll move you back here. And we'll move the chair. And then if you'll stand right here, we're going to do CVA tenderness. So any tenderness here? There?
No.
Nope. Okay, and then you can sit down. Okay, So next we're going to do, we're going to look at the fingers, wrists, elbows, and shoulders. We're going to be looking for any redness, swelling, tenderness, nodules, deformities, anything that would be abnormal. Make sure everything's symmetrical, and we're going to palpate. Okay, and then we're going to check capillary refill. It's less than 3 seconds. I'm going to check the radial pulses. It's 2+. Okay, so now we're going to start range of motion of the fingers. So we have an extension. We'll do flexion, hyperextension, abduction, adduction, and thumb opposition. Now we'll move to the wrist. So we have extension, flexion, hyperextension, radial deviation, ulnar deviation, and rotation. Then we'll do elbows. We are in extension here, so we'll do flexion, hyperextension, and then we'll do shoulders. So we'll start with extension. We'll have flexion, hyperextension. We'll do external rotation, internal rotation. Abduction is going to be out. Adduction is in, and then circumduction, just give us a big whirl. Perfect. Okay, we'll do strength. So the hand, so great, 5 out of 5. Then we'll do tricep, bicep strength, so push up, push down. We'll do shoulder strength, so push out and in. And then we'll try cranial nerve number 11, spinal accessory, push up. Perfect. Next, we're going to check sternocleidosis and graphisia. So I'm going to put something in your hand and close your eyes, and you just tell me what you feel.
Is that key?
Perfect. Okay. And we'll check graphisia. I'm going to write something in your hand, and then both hands, and you tell me what they are.
6.
Okay.
7.
Perfect. And next, we're going to do rapid alternating movements. So if you'll just kind of touch each finger to your thumb. Perfect. Hand flip flop. And then if you'll touch your fingers really quickly to my finger. Perfect. So next we're going to look at upper and lower extremities, looking for skin integrity. We're going to be looking for normal color, temperature, anything like that. Then we're going to assess light touch for the upper and lower extremity. So if you'll just tell me if you feel what arm or leg.
Arm, leg, arm.
Perfect. Okay, and next we're going to do vibratory sensation here. So I'm going to ring this and put it on either your wrist or your ankle, and you just tell me if you feel it.
I can feel it.
Okay.
I can feel it.
Perfect.
I can feel it.
Perfect.
I can feel it.
So next we're going to move on to deep tendon reflexes. Okay, so we have brachioradialis here. We have bicep here. We have tricep. Same thing over here. So brachioradialis, bicep, and then tricep. We have patellar, and then Achilles, and then we'll check Babinski's. Okay. So then we're going to look at the toes, ankles, knees, and hips. We're going to be looking and palpating for any redness, swelling, nodules, crepitus, symmetry, anything that would be abnormal. Then we're going to check kappa refill, which is less than 3 seconds. We're going to check dorsalis pedis and posterior tibial pulses. Okay, so it's 2+. And then we'll start range of motion with the toes. So we're in extension now. If you'll point them down, that's flexion, just the toes. Down, flexion, hyperextension, abduction, adduction. Perfect. Then we'll do the ankles. So we're in extension just normally now. And then we'll do plantar flexion, dorsiflexion, inversion, eversion, and rotation. Then we'll do strength. So if you'll push down, perfect, and push up, Perfect, so 5 out of 5. And if you'll push out here and down here, okay, 5 out of 5 for the knee. And then if you'll push out here and in here, so 5 out of 5 for the hip. Stand up. Okay, so now we'll do a range of motion for the knee. So we are in extension now. If you'll kick back and say move flexion, and then lock them out, hyperextension. Perfect, and then we'll do the hip. So we're in extension now, so we'll do flexion and kick back, so hyperextension. And then we'll have external rotation and then internal rotation. And then kick out, abduction, adduction, kick in. And then circumduction, we'll give a big whirl. Okay, perfect. Next, we'll have you kind of turn, bend over, and we're just going to take a look at the spine. This is lumbar spinal flexion, so we're going to look for any scoliosis, malalignment, any tenderness, anything that would be abnormal, none noted. So we'll have you stand up and face forward. So that was spinal flexion. We're in extension now. We're going to hyperextension, lateral flexion, or rotation. Perfect. So now we'll move to the cervical spine. So we're in extension now. We'll move to flexion, bend forward, hyperextension, move back, lateral flexion, and then rotation. Perfect. So now we'll do the Romberg test. So I'll just have you stand here and hold out your arms and close your eyes. Okay, so now we're looking for if she was to fall over or lose balance, but it was normal. So now we'll have you walk just normal 5 steps and then heel to toe on the way back. Okay, so gait is normal and tandem. And lastly, are you able to hop on one foot?
No.
Okay, so for safety reasons, we will not have her hop on one foot. Thank you.